Medical Mutts was founded in 2013 with two goals in mind: helping people who suffer with a disability and helping homeless and abandoned dogs get a new lease on life. We specialize in training dogs for diabetes, for epileptic seizures, for psychiatric conditions, but we also often train for other conditions like POTS or autism spectrum disorder or light mobility. What some of those conditions have in common is a release of a smell. We can use smell to teach the dogs that a person is having a hypoglycemic episode or is about to have a seizure or even a panic attack. So our dogs have been involved in different studies. We were the first ones to prove that there was a scent related to a hypoglycemic sample. We were also the first ones to prove that there was a scent related to seizures, and that allowed other scientists to take on, and now there's a whole field of study in that area. So we use scent to tell the dogs that it's time to react, and we train them to do very specific tasks depending on the condition. So for our clients, this is a life changer, sometimes even a life saver. If somebody is about to have a seizure and the dog can let them know beforehand, it gives them time to get into a safe position so that they can sit down, lay down, and potentially avoid a really dangerous fall. We work with people whose life has been made really difficult by a debilitating condition that they cannot easily control.
The technology has come forward, but it's not where it needs to be yet. And those situations where you have a really rapid drop, or you have a mistake with the machine, or your continuous glucose monitor, which tells you your glucose level all the time, comes out, and you're trying to manage finger sticks and you think you're fine, and all of a sudden you can't talk. And that's a really scary thing. So Banjo, the dog that I have, can alert me to these changes. He can smell it.
This is my service dog, Jai. He is from Medical Mutts. He is, quite honestly, the love of my life. My name is Kathleen. I have been a diabetic, type 1 diabetic for 33 years. He has helped me gain a sense of independence that allows me to be in my home, allows me to be away from my home, and know that I have someone else that's watching out for my health just as much as I try to.
A dog can alert when somebody has a hypoglycemic episode, or is about to have a seizure, or is about to have a panic attack.
So I have schizoaffective disorder. I came down with that about 10 years ago. Eventually, I got to a point where traditional methods weren't doing enough. I was locked up in this apartment, too afraid to ever leave. Panic attacks would be overwhelming. With Ray, he has kept any paranoid thoughts when I'm out of my head. I'm completely focused on him and what he's doing out there.
Of course, there's a real interview of an hour with our applicants first. And there we try to decide where do they live, what kind of environment do they live in, and what sort of dog would be good for that. What kind of dog are they looking for? What size of dog are they looking for? And I'm trying to sort of feel what kind of personality that dog should have. I ask them specifically for that as well. And I often get things like, I want a cuddly dog, I want a dog that's big enough so when he's on my lap I really have enough weight. Some people want to make sure that there's enough room between them and other people. So these are parameters that I can already decide right there in the interview.
But the other end of the leash is equally important to us, the dogs. We care deeply about the animals that we train, and we want to make sure that they get something out of it as well. We care about their well-being. A lot of reasons why dogs end up in a shelter is because their owners move away, or they have a child, or they have a life-changing situation that makes it to where they can't care for their dog anymore. So it's not that the dog is necessarily bad at all. It's just that the life of their owner has changed and they can't care for them. This was not an easy route for us. It took a lot of work to get to where we are, but it felt like the right choice. The dogs that we train all come from rescues and shelters. Now that doesn't mean that we can just go to a shelter and pick a few dogs. It's not that easy. We look for the dogs that have the right qualities to be a service dog, and most dogs don't have that.
We travel to shelters pretty much every week looking for dogs that meet our criteria. We want dogs who are friendly with people, comfortable around people, what we call Velcro dogs, so dogs that want to be next to you all the time. Comfortable enough to approach a new person to say hi and solicit attention or petting. We also want dogs who are confident, who can approach a new situation and be comfortable and not overly fearful. They can startle if something, suddenly, if there's a sudden loud noise, but we want them to recover quickly. We're looking a lot at resilience. They can go into a new situation and kind of take their surroundings and bearings and then be ready to focus on their person. We also look at food motivation. So we want dogs who can work for even dry food or kibble. They do need to be comfortable with other dogs because if they're out and an unknown dog runs up to them, they need to be safe.
Dogs that don't make it are placed in good homes, but the dogs that do make it as service dogs are paired with a person who are going to rely on them. They will never be abandoned again. And not only that, but the bond between a person and their service dog is really special, is very deep, because each one is taking care of the other. So it's a mutually beneficial relationship that they'll share.
The reason that I chose Medical Mutts was for the fact of the Mutts. And the reason too is just the people at Medical Mutts. Their kindness, their instinctive ability to be able to take a dog and have them do a job for you that you didn't even know you needed until they're there.
When we match a dog with a person, they get invited to 10 days here at our facility. That is called team training. That's when they start to become a team. That's when the human part of the team learns all those communication skills that the dog already knows. They don't know it with their team person.
Our training methods are also all positive. So what that means is you'll never see a choke chain, a prong collar, or a shot collar at our facility. Instead, the dogs are always rewarded for what they do. They get something out of it too.
We want the training to be fun for the dog. So a lot of people think service dogs have a kind of a dreary life. They have to work all the time. But our dogs just have a lot of opportunities to earn rewards and earn treats.
We rely mostly on science and on ways to motivate the dog to really want to do what it is that we need. So we don't use force. The dogs learn that when they choose the behavior that we want, they get rewarded for that. And this is really important because to get a high quality dog that is going to take initiative to help a person, you don't want that dog to have any kind of hesitation. If, for instance, we wanted to teach a dog a downstay by scolding the dog or jerking the dog if it got out of position, then the day that dog smells that there's an imminent seizure, that dog may hesitate and question whether or not it's a safe time to get up. That's not what we want to see. We want to see dogs that do not hesitate and have the ability to think through a situation, to problem solve, and go straight to what they need to do. The other part that's important to us is just simply how we treat the dogs. When we talk to our dogs in a natural tone of voice or a happy tone of voice, they are so much happier than if we are barking commands at them and demanding that they obey because we decided to. So when they get something out of it, it increases their well-being. Yes, we want dogs that are highly performant and can really help somebody, but it cannot be at their expense. They have to get something out of it too. Training service dogs is very expensive. Only 1 out of 3 or out of every 4 dogs ends up making it as a service dog. But each dog that comes into our facility needs training and needs medical attention. And that's really costly. So the more help that we get, the more dogs we can train and the more people we can help. The best way that you can help us is with a donation, with sponsorship, or by volunteering. On our website, medicalmutts.org, you'll find lots of ways to contribute and be a part of our mission.
Every time we pass someone, they see him and they always smile. And just knowing that he's bringing a smile to everybody's face that he sees makes me feel better too. Every day he makes me happy. I couldn't imagine not having him.